A little more. Be able to come back down. I have one with no air bubbles. I'm going to drop 0.2 milliliters of air to seal the injection site. I'm going to attach that.
She did say you have to use gloves. Remember, I was like, should you change your gloves?
That is ready to go. So I now have 1 milliliter of penicillin G. I have 1 milliliter of penicillin G. It is 1 milliliter, 1 million units per milliliter. I have 1 milliliter here. It is given intramuscularly every 4 hours. It is now the 25th. She has not had it yet. I'm going to give it to her. I have her fluoxetine Prozac, 10 milligrams by mouth at 9 a.m. She's not had it yet today. I'm going to give it to her. Her third is her albuterol inhaler. 2 puffs twice a day with spacer as needed. It is 9 a.m. She's not had it. I have assessed her to have it, and then it is the 25th, and I'm going to give that to her as well. I'm going to have water in my cup so she can take her pill. I'm going to make sure that the card is locked before I leave. I'm going to knock if possible and say, "Hi, Mrs. Davis. I'm Aubrielle. I'm your med nurse. I had come in and spoke with you earlier today, and I know that you were a little short of breath, so I said I was going to go get your meds and also get your inhaler for you. So I'm going to go ahead and wash my hands real quick. Wash my hands to provide privacy. I'm going to, but before I can do that, I need to verify that you're who I'm supposed to be giving it to. So can you tell me your name and your date of birth? Deanna Davis, 5/6/1943. Checking against the MAR of the band. That's great. Thank you very much. So I spoke with you earlier, and we have your albuterol inhaler, meter dose inhaler with your spacer. You take this for your shortness of breath. Some of the side effects are going to be restlessness, nervousness, and maybe some chest pain. Does this sound like what you normally take? Yes, it does. Okay, thank you. And then we also have your Prozac that you take daily. Does that sound familiar? It does? Okay, great. And then we also have your penicillin injection for your cellulitis going on in your left leg. I'm going to give it to you in your right hip so that it doesn't hurt your leg over here, okay? Does that sound like what the doctor had ordered and what he's discussed with you? It does? Okay, great. Is there one that you'd like to start with? No? Well, how about we start with your inhaler? That way we can get you breathing a little easier before we do anything else. So, this is how we're going to do this one. I'm going to put it in here, and it's going to put the actual medication into the chamber, and I'm going to have you seal your lips around this perfectly to create like a suction, like a vacuum, for you to be able to breathe it in a little easier. I'm going to give you 1 puff, and then it's going to go into the chamber, and you're going to inhale slowly for about 10 seconds, and you're going to hold it for about 10 seconds, and then you're going to breathe it out, and then we're going to wait a minute and do it again. Is that okay? Do you understand that? Okay, thank you. So, she would be sitting up, so then we're going to go in. Are your lips around there? That's great. So, on the count of 3, take a deep, all your breath out, and then take a deep breath in, okay? Out. 1, 2, 3, puff in. 1, 2, 3, 8, 9, 10, that's great. And hold it. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and out. That's great. You did a good job. Now we're going to wait a minute. We're going to do it again, okay? I'm going to wait. It's been a minute. We're going to do it again. So, okay. Put your lips around it and seal it. Good job. And on the count of 3, we're going to take a deep breath in. Breathe out. 1, 2, 3. Puff, deep breath in.
I also
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And hold it for 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Good job. Nice deep breath out. You did great, Mrs. Davis. Now your next medication is going to be your Prozac. But before I can give it to you, I should have done a third check for the inhaler part here, because I didn't change it. So before I give it to you, I just need to do one check, okay? So we're going to have Prozac 10 milligrams, Prozac 10 milligrams, She's not had it, I'm going to give it to her now.
Well, you got it. I don't
Open it. I would have done the inhaler here prior to giving it as well. So, here's your pill. Do you normally give this to yourself? Okay. Well, here's some of the side effects on this one. I want you to let me know if you have any type of headache, nausea, or any problems trying to sleep, okay? Because that's some of the things that could happen. Okay, so here you go. And a drink, drink, swallow. Let me see, that's great, thank you very much. And your last one we have is your injection. That's for your cellulitis in your left leg. So, I put on my gloves, I'm going to bring it. I'm going to be giving this on your right hip. So, give this one without exposing her too much. And of course, it's so I'm going to be giving this onto your right hip.
What would you do?
What do you mean, what would I do? Oh, pull up the bed rail. Good job. Thank you. She's not the most helpful patient. So, alright, good job getting on your hip for me. So, I'm going to put my hand right here in your trochanter. And I'm going to put my first finger over here in your anterior iliac spine. My other finger is going to go towards your posterior iliac spine. It's going to create this V. And that's going to create exactly where I'm going to give you this shot. Injection. But before I do that, I should open up the what I need. Okay, that helped. Okay, so I'm going to do that first. I'm going to go ahead and clean the area.
Since I have 2 milligrams.
Circles going around.
The label says 2 milligrams for every milliliter.
Nice circular motion.
2 milliliters. So I'm going to use right?
So, again, yeah, I did. I put them on over there. I'm going to put my hand on the trochanter this way and this way. Find my V, anterior and posterior. I'm going to go to 90-degree angle. I'm going to go straight down. I'm going to aspirate about 5 to 10 seconds. 6, 7, 8, 9, 10. There's no blood. I'm going to inject slowly.
1.5 inch, and I'm giving this because I'm giving the shot in the...
I'm going to go straight out. I'm going to go straight to the sharps container. Drop it. There was no 2x2, so I'm going to take my 2x2 now. Wipe it and gently massage it. You did great, Mrs. Davis. I know it's a little sore, I'm sorry. But I want you to keep massaging this even after I'm done, because that's going to help it get into your muscle faster and help it get where it needs to go. I'm going to apply a Band-Aid. Make sure that she's comfortable with that, understanding she's supposed to still massage it so that she doesn't get all stiff. I'm going to cover you back up here, and let's get you to lay back on this side. Roll back to me. Good job. And it'll lay down like trash can. So I'm going to finish filling out your record while I'm here. So why don't you let me know how you're feeling? If there's anything going on, let me know. Come over and take that. One of the times that I gave it to her. Flip it over. Make sure that I sign my name so that it's on there. And then I'm going to give her as needed. Is everything feeling okay, Mrs. Davis? It is? Okay, well, I'm going to come back in about 30 minutes to check on you. Here's your call light. I have you nice and low, so if there's anything that you need, you let me know ahead of time. But if not, I will be back in 30 minutes to make sure that everything feels okay and everything's going all right. Thank you, Mrs. Davis. Have a good day. I'm going to leave, and then I will come back in 30 minutes to reassess her breathing and make sure that everything's going okay.
Good.